a brain that works a little bit better or a lot better on a ketogenic diet can make much better gains and have better treatment effects using those psychotherapy tools. If you go to your average mental health counselor and you say, hey, I would like to do this for my mental illness, they're going to tell you not to do it. They're going to tell you it's going to give you an eating disorder. This is an intervention that can save lives or quality of lives.
Welcome, everybody. We have with us today Nicole Laurent, or Laurent. I'm not sure how you say that, but you can correct me on that. Either's fine. Sounds like kind of a French-sounding name, so Laurent maybe is how you might say it in French. My wife's French, so I kind of know some of this stuff. But anyway, you said a licensed mental health counselor, and I guess maybe just tell us a little bit about your background, how you got started in doing what you do, and what actually do you do these days?
So I transition people into the use of ketogenic diets as a treatment for mental illness. So I'm a licensed mental counselor in Washington State, and outside of Washington State, I do private consultation all over the world. And I have an online program that I bring people in for this purpose. And I help people initiate ketogenic diets as a potential recovery for serious mental illness.
Yeah, that's wonderful and awesome, and I'm glad that there are more people that are looking into this and doing this. It's something that I noticed, early on when I started, talking about diets. And I started out on a ketogenic diet, and obviously I'm a guy that talks about these carnivore diets, right?
Yeah.
One of the things that I've seen consistently over time is that diet does impact mental health, which was, 5 years ago, a controversial statement. You tell people that, hey, I see people putting their bipolar disorder in remission by changing their diet. And they thought you're nuts. They're like, how dare you,
Exactly.
How dare you imply that nutrition could impact mental health? You have to have all this, cognitive behavioral therapy and desensitization training and all this stuff because of these traumas that people might have been suffering from those people that, PTSD and things like that. And that just by eating nutrition could never possibly affect that. And now fast forward to 2025, and now we have lots of studies have come out, a lot of it courtesy of the Bazooki Foundation. I don't know if you know Jen Bazooki. I met her in Las Vegas a while ago. But because, just people like yourself and others is saying, hey, look, this is what we're seeing. We're now getting some of the research, and finally somebody's willing to fund some of that stuff. And the research coming out almost on a weekly basis, case series and intervention reports is really, really amazing. And it just echoes what I've been seeing clinically over the last at least decade now. Why do you think, and this is always an interesting question, we always know why do you think a ketogenic diet impacts mental health, and how does it do so beneficially?
I think that in serious mental illness and really all the disorders. So I have this little, back in the day before there was Metabolic Mind educating people so well about this potential treatment, there wasn't really anything on the internet. And so I started this blog called mentalhealthketo.com. And I was like, I need to be able to explain the whys of this the same way as we attempt to do so with medications for people, because they just kind of don't understand how this would help or how it could help. So I identified, or in the research, they kind of identified these 4 different pleiotropic pathways that they think ketogenic diets help mental illness with. And, obvious things like glucose hypometabolism. If you starve a brain, everything downstream gets affected. Oxidative stress, neuroinflammation, and neurotransmitter function, right? And so I went and I started to look up all the DSM-5 diagnoses and asked, is there evidence in the research showing that there are issues with hypometabolism, with neuroinflammation, with oxidative stress, with alleged or conceptualized neurotransmitter imbalances or function? And yes, absolutely, all of them. And so I spent my weekends writing these blog posts, getting kind of better educated about this. So ketogenic diets heal brains is what I tell people. It's been used in epilepsy, as you know, for 100 years or more. And really the healing trajectory that we see in epilepsy, in my clinical experience, I'm seeing being mirrored in mental health populations. And so it's really profound. And I know what you're saying about the anger of suggesting that this is possible, because in 2022, when I started to do research to develop my online program, I went into the depths of Reddit and the Facebook groups and the Twitter, and I was trying to get research and ask questions about this, and to see if I could create a program where people would do as well with me in my program as individual consultation. And oh, the anger and the invalidation that people felt around this. It was just so clear that it was too soon. And so I actually rebranded my program, the Brain Fog Recovery Program, to kind of back off from that. But really, it's a metabolic psychiatry kind of program. And that's what my intent was. But I know what you mean. People get very upset, I'm a psychotherapist, so I've been doing evidence-based treatments like EMDR and exposure therapy and DBT trained and CBT trained, and I will tell you, a brain that works a little bit better or a lot better on a ketogenic diet can make much better gains and have better treatment effects using those psychotherapy tools.
Yeah, I think, and I think this is consistent for all chronic diseases, whether it's mental health or some other chronic disease, diabetes, or something like that. Diet is a fundamental pillar of that treatment. And I think it is probably impossible to fully treat somebody without good, solid nutrition foundation, whether it's a ketogenic diet or some other healthier diet, because so many people are out there. And I think that's one thing that I just kept seeing over and over again with this carnivore stuff. Is people saying, hey, my brain fog lifted, my my depression went away, my anxiety is going away. And like you, what I've seen is, there's different ways to implement certain diets. And I find that people that in the context of a carnivore diet, to do it in a more ketogenic style, it just seems to affect the central nervous system a little more effectively than, maybe if you're, veering more towards a higher protein approach. So I think, and as you mentioned, it's probably multifactorially affects a whole host of things, whether it's brain inflammation, whether it's just providing the actual nutrition that the brain requires, whether it's the energy fluctuations or providing consistent energy via ketones rather than, glucose that tends to be very labile. Let me ask you this question about what do you, obviously you're going to, the more common things you're going to see get better commonly because there's just more of them. I mean, there's a lot more people that have depression than have schizophrenia. So, we see that play out I just see that if something's real common, I see the diet affects it more commonly. How long typically does it take for someone that's out there listening and been struggling with mental health issues? How long in general, once you start properly nourishing yourself, does it seem to take to fix various things? I've seen some studies published on this, on anxiety and depression, and it seems like anxiety resolves a little quicker than depression does. But what has been your clinical experience?
So it really varies. And I would say the majority of the people who come to me are already on what they believe is a ketogenic diet or some attempt at a ketogenic diet. So most of my people that I work with are already eating low carb, but they're not quite getting treatment effects. And so I always tell them, your clock doesn't start until I've done your macros and you're following them appropriately. That's when you start your clock. So that's an important piece, because some people will come in and be like, oh, I've been doing this for 7 months. You've been doing it. You've been doing something towards that, but hasn't quite been like a medical ketogenic diet for what you're trying to use it for. So it really varies. So some people have these kind of spectacular within 12 weeks remissions. And I know because I published quite a few of those case studies, depression, chronic depression, OCD. So often in 12 weeks, people can get really astounding recoveries. But I've also worked with people where it has taken 7 months of very consistent work. It just kind of depends on what is going on. And, I've also seen, things where people had benefit and then the benefit kind of stopped. And then we had to fiddle with things like maybe they had to take dairy out for them. That was a big issue. Or they needed to take out some plant foods. right? So they were getting some irritation around that, and so it's such a hard question because I know everybody wants to know the answer to that, but I haven't really worked with anybody, and I say this quite confidently. I have not worked with anybody who has not had some benefit from a ketogenic diet, whether it's a ketogenic carnivore diet or the regular one that we use. There's usually some benefit, some stabilization, or some improvement that they get, even if it's just a reduction in medication side effects.
Yeah, and I think that's something, and again, at Revero, when we see it, our patients are often surprised that, making some subtle adjustments that our team does has a significant benefit. So you are right. A lot of people are implementing this thing. They saw something online, they try to follow it, and maybe they're just missing a few things, and having a little bit of guidance is sometimes helpful, and accountability and support. I think those things are important for a lot of people because, as you probably know, and I think it's irrespective of the chronic disease you're dealing with, and mental health being no different, if they don't have a supportive environment, whether it's a supportive physician or household or employment, then it's going to be harder for them. And so at least supplying that piece that says, hey, I'm here to support you in your nutrition and other things. And I think also nutrition isn't the only piece, as you probably know. I mean, sleep is important, activity is important. There's so many just basic lifestyle things that most people are just leaving out. And once you fix that, it becomes quite helpful. What about, obviously, most people with a mental health illness are put on drugs. I mean, that's pretty fair to say. I mean, the field of psychiatry is just drug intensive, whether it's SSRIs or, membrane stabilization drugs, lithiums, and, all the different medications out there. How often are you able to see people coming off drugs? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up though, our spaces are filling up very quickly.
Yes, well, I see how often, gosh, I wish all of us clinicians that do this would, aggregate our data in kind of one place so we could keep track of all this way. But many people will stay on some small amount of medication. So what happens is they come and see me and they get really a lot better and they feel really good. And then they go off and live their life. And then is the precarious time, I call it a precarious time, where they attempt to reduce medications with the help of their prescriber. And what I am finding is that a lot of prescribers believe that they are good at tapering or educated about tapering and actually are not. And sometimes it is very dangerous because this idea they have that they're really good at tapering, but they don't know anything about hyperbolic tapering practices, which is now becoming a standard practice in like the UK and Australia, but America is slow to take this on. That you can cause a relapse in someone that isn't a return of their symptoms, but is a response to being taken off medications too quickly. There's something called rebound psychosis, for example. So the ketogenic diet is the first part for this population, is mastering their ketogenic diet, getting good at it, being consistent with it, getting the ketone levels nice and high and stable. But there's a whole second piece to psychiatric recovery using ketogenic diets, and that is self-educating yourself about hyperbolic tapering practices so you can have informed conversations with your prescriber so they do not put you at risk of harm.
Yeah, that is an underappreciated point, I think, for a lot of drugs. People that often we see are on a number of medications, and we do have to very intelligently deprescribe, reduce, and it can be a process because as you are obviously, as you point out, there can be some negative effects to tapering too quickly or pulling people off drugs. You kind of just haphazardly can really end up harming them. And so that's something that I think is important because as a physician, deprescription was not part of my training, to be honest. I mean, it was just like, you get this is what you put them on. And they never really talked about how to take people off drugs. There's a few that we kind of knew that if somebody stopped abruptly, it would cause a real problem. But in general, there's not a lot of data on that in the first place, because so many people, because these drugs are designed for you to be taking them indefinitely for the rest of your life, and
Right.
deprescription is not really even a goal, which it
Right.
should be. I mean, we should be thinking about chronic disease in the terms of how to actually cure it. So we are, or put it in remission, whatever semantics you want to use, and then how do you fully facilitate that? Um, do you find that there is any sort of differences between men and women in this sort of aspect? I mean, some people do, some people don't. I mean, is
In terms of recovery?
yeah, or how you might manage these things.
Oh, I see beautiful recoveries in men and women all the
Mhm.
time, quite well. Um, in terms of yeah, in medication also, I've got both genders with tons of medication. I mean, they come to me on huge cocktails of medication, and I'm not a prescriber. I'm a licensed mental health counselor, and so
Yeah, so you can't deprescribe. Yeah, no, not
I
legally. You
cannot
can't. Right.
help. I can't help, and I can't even give any advice because that's outside of my scope. But I do send them to self-education resources where they can self-educate about it and then have conversations with their prescriber.
Yeah, that is a challenge. Most people don't realize this, that you have to be a licensed physician not only to prescribe medication, but also to deprescribe. If you were to tell somebody, hey, stop taking your SSRI, that would be practicing medicine without a license, and you could be held
Yeah,
accountable for that. So
absolutely.
that's why we have Revero. So our physicians actually can deprescribe, and they're
Yeah,
they're very motivated to do so. And,
yeah,
there are, there are a number of now psychiatrists which do tend to prescribe and deprescribe medication that are, you know, entering this new emerging space of metabolic psychiatry, which is, I think, really awesome to see.
yeah.
Hats off to Georgia and Chris Palmer and some of the people I've known for years have been talking about this stuff as I have. Do you find that? Well, let's just go through the litany of things that you think a ketogenic diet can help with regard to mental health. I mean, just what do you see? What are the things that are out there?
Yeah. So, it's being talked about in the research literature as a transdiagnostic intervention in
Mm-hmm.
mental health. And so, people will come to me and they will very, very much want to tell me all of their diagnoses that they've had over the years, the different labels that have kind of been put on them. And I tell them, I kind of don't care what those are. And that's not because I don't care about their experience. It's because I understand that the intervention that I'm using is transdiagnostic in nature, meaning people experience different symptoms as a result of their brain not working properly or there being something going on in the brain. And so I see beautiful recoveries and great improvements in all different diagnoses. There are epilepsy dietitians that I know who use it for autism all the time. That's not the population I work with, but from the run of the mill kind of someone just self identifies as quite anxious or overwhelmed to, serious mental illness, it runs the range of improvements. And it's got, like I said, so many pleiotropic effects. There's so many pathways in which a ketogenic diet has influence and effects. It's just such a different paradigm than what's being used with medication, which is about just symptoms. I call it squashing. How to trying to reduce the symptom, and it has nothing to do with healing a brain. And this is something very different.
Yeah, I mean, I've certainly seen depression, bipolar, anxiety,
Mm-hmm.
schizophrenia, schizoaffective disorder, borderline personality disorder, ADHD, Tourette's syndrome. All these things
Yeah,
get better with diet, and it's just amazing that you see that. And the fact that this isn't a first line treatment early on is a shame, because I think it would save people suffering. Many people, have probably suffered with mental health disorders for not even years, but
lifetimes.
decades.
Yeah,
And then they finally get this, and it's like, I've been suffering for 30 years, and I did a dietary intervention, and 3 months later I'm better. That, I mean, it's great that it happens, but it's just like, wow, look at all that suffering you could have avoided, and all the negative effects that
yeah,
occurred due to this, and the other people that it impacted, because mental health just doesn't affect the individual, it affects everybody around them, as I'm sure you're quite aware. um what so ketogenic diets, I'm a big fan of them. And particularly when you combine them with carnivore diets, I've seen some tremendous health benefits in mental health and others.
Yeah.
What other things, I mean, you mentioned a number of things you're trained in. What are some of the other big things? I think sleep is incredibly important. I don't know what your thoughts are on
Yeah.
that, but what do you find are the big levers that you need to pull?
Yeah. Well, I like to pull the ketogenic diet lever first because I think that is one of the most powerful metabolic psychiatry interventions we have in our toolkit. And I like to see what gets better with that first. And often it is things like sleep and energy. But then once they're a little bit stable on that, and we've got the other nutritional components in place for healing, like you said, you got to have the basic building blocks to do to make the enzymes. You need to do the processes to make a body work, and ignoring that makes no sense. So then we bring in the other metabolic psychiatry lifestyle interventions, which include, sleep hygiene, meal timing, light exposure, exercise, socialization. All those things seem to come a little bit easier for people once their brains are working just a little bit better. But, I have seen someone doesn't pay attention to sleep. I have seen their ketogenic diet not work well. If they want to use substances like, different substances, like maybe they're using cannabis, or they're used to using cannabis for sleep instead of getting to the place where they can sleep without substances. I've seen that, that can impair a ketogenic diet. One bad night of sleep, that affects your metabolism profoundly. And so yes, it really is kind of a package that it's not just the ketogenic diet, it's all the other lifestyle pieces that you need to put into place. The ketogenic diet's just the base.
Yeah, I totally agree with that. I mean, because a lot of people, I am a huge proponent of exercise. I think it's wonderful.
Mm-hmm.
I try to practice what I preach and hopefully inspire some other people to do so. But one of the things I find is that, a lot of people are in a position where they can't do that initially because, I mean, their body just hurts. I mean, they're inflamed.
Yeah.
Everything hurts. Their knee hurts. Their back hurts. They have no energy. And you can't expect, well, you just need to go in a gym and grind it out. That's not going to work for
Yeah.
them. So you have to fix some of the underlying inflammatory issues, maybe improve their sleep. Then you can start to say, okay, now we can roll this in. So it is a process over time, and it takes a lot of hand holding. I find. I mean, how do you find that? I mean, it probably isn't just one and done with you. I imagine it's you
Yeah.
kind of you need some sort of reassurance, some rechecking in, some reevaluating, some readjusting. How frequently do you like to have contact with your clients?
Yeah, well, it depends on, where they're at when they start with me. Some people are coming in with a full standard American diet, and that takes a little bit of time. But for like I said, many of the people are on low carb diets, and so we kind of get to go a little bit faster. But for private consultation, if they're coming from a standard American diet, I will ask to see them twice a week for 30 minutes for at least 3 months. And I have them schedule that in, and keep those appointments, because for me, I really like the 2 times a week check-in for people. If they're already low carb and they've kind of got a little bit of a base going on, we'll do, one 30-minute check-in a week for 3 months. And then we move to, 2 weeks or once a month. And then, and again, it depends how much they want to do also. So for private consultation, they come to you. But with my online program, we do 2 live Q&As a week for at least 3 months. I tell them to schedule them in and to kind of treat them like doctor's appointments so that they come, and that's really nice because that's a group setting. Like you were saying, that extra support, having your people, because it's such a countercultural thing that we do from a psychology standpoint, to eat so different than what is being made available in the food environment, that it's really nice to have the group piece to kind of counter that, and let them see, oh, this is where this person is in their healing. This is how this person handles that situation. And so, yeah, I guess there is a little bit of hand holding, but um, it's totally fine. They're just such a wonderful group to work with. And they are all so wanting to be well. Like people, I don't, sometimes there's a little bit of negativity in the space and they're like, oh, this person doesn't care about themselves, or but I think that people really want to be well. And if they know that there's a possibility that they could actually not just be well, but thrive, I think they're highly motivated. And I think that's part of why all these like case studies and case reports that I publish in the peer review literature have done so well, is because people are very hungry for those stories. And being told that there's a possibility of that is really quite motivating. And so my people that come to see me, I always laugh about this. They're like, get out of the way and tell me what to do. Like, just tell me what to do, lady, right? Tell me exactly what I need to do next. And they will do it. And this is serious mental illness populations where the research literature has shown that they absolutely can adhere to a ketogenic diet, and they can absolutely do everyday testing of ketones and glucose. And this is a serious mental illness population that is very motivated to get well. And so it's just an absolute joy to work with them. It's easy peasy is what I tell them.
Yeah, that's something that I've seen and our physicians at Revero see is it's just fun. I mean, it's like you got patients that want to actually get better. They're not here just to get another pill. They're actually wanting to make those lifestyle changes. So it's nice when you have those people to deal with. Now, as a licensed mental health counselor, I'm sure you had some training you went through. I'm sure there's an organization that sort of oversees all that. Yeah. What has been the position of that organization? And I'm not sure, you may be sure the name of that. And what is their thought on nutrition in mental health? Do they just completely discount it completely? And I'm sure if they don't, ketogenic diets are probably not being overly prescribed. Is that fair to say?
They're not. It's crickets. It's frustratingly crickets. So so there's different organizations. There's the Counseling Association, and then there's the American Psychological Association that I'm an associate in. And there has been a continuing education credit in nutrition and psychology. It's not. It's probably very good quality. APA CEUs are very good quality, but it certainly is not talking about ketogenic diets. So nutritional psychology and nutritional psychiatry is very kind of focused on things like the gut microbiome and what are the psychological or psychobiological effects of certain foods. It's really the metabolic piece is out of their frame of reference at this point. And so it's been crickets, and which is very frustrating. There hasn't been any metabolic psychiatry type of publications in any of the APA, American Psychological Association journals yet. Me and a group of authors published something about the role of clinical psychology in ketogenic diets, because right now, if you go to your average mental health counselor and you say, hey, I would like to do this for my mental illness, they're going to tell you not to do it. They're going to tell you it's going to give you an eating disorder, or they're going to accidentally leak their own kind of ideas about nutrition into the session, which is not ethical practice, which is why I also have a continuing education course for psychotherapists, not to initiate the diet by any means, but to just learn the basics, to just kind of learn how not to do harm by discouraging someone from trying it, and how not to practice unethically by leaking your own preconceived biases into the session. Because, I mean, this is, like I always say this because I think it's true. This is an intervention that can save lives or quality of lives. So there's a very high suicide rate for people with mental illness. So what is the ethical implications of discouraging them from doing this intervention, knowing that, the possibility of suicide in the next 5 or 10 years is so high, right? So it's a big deal. And I want to do more work in the psychology space to make this understood.
Yeah, when we talk about eating disorders, I would make the argument that the standard Western diet is actually, in fact, an eating disorder. I mean, you think about it, because, I mean, you literally are doing, known harm to yourself. I mean, at this point, it's not even debatable. And yet that is in no way really discouraged for the most part. I mean, it's just kind of like, well, you only live once. You got to enjoy yourself. Don't restrict any foods, type of thing. We get that from many of the dietitians with the sort of sentiment that there are no bad foods. And I go in the grocery store and they've got blue Captain Crunch flavored artificial maple syrup. I'm like, how is that
Yeah.
not bad for you? But
Yeah.
anyway, as you know, it's frustrating, but less so than it used to be. I think there are, and maybe I live in a little bit of a bubble and a kind of bit of an echo chamber, but I have seen metabolic psychiatry growing by leaps and bounds over the last few years.
Yes.
And maybe it hasn't reached mainstream, uh, you know, uh, recognition yet, but I think it's coming. I mean, you have to be aware of it. And,
Yeah.
congratulations to people like yourself who are putting some of that literature out there. And I'm sure I probably reshared some of the studies you've put out there, because every time I see one, I'm like, I try to share this to as many people as
Yeah.
possible, because I just see it saving lives as you do. And it's so important to get these messages out there. And maybe it's not for everybody, but hell, why not just try it, and see what happens? I mean, I don't think there's a
Yeah.
downside to trying these things. I mean, unless, do you disagree with that?
No, there's not a downside to trying it. I would say that if you are on a lot of psychiatric medications, just go on ahead and work with someone, um, because you might need your medications adjusted quite quickly. So the increased fat intake on a ketogenic diet makes existing uh, antipsychotic medications work better, metabolize differently. And some people, you really shouldn't do a medical ketogenic diet without a ketogenic professional and a prescriber monitoring your medications. But yes, with proper support, absolutely try it. And I want to say, if it's okay, that this is not standard of care yet. So people with mental illness can't just they can and they might get some support, but often it's not covered. It's not something that's covered by insurance. And so access is a really big piece of this for people. And so people who are on psychiatric disability or are very low income because their functioning has been so low over the years with in ineffective care, quite frankly, right? So they have a hard time accessing a ketogenic professional on their treatment team. And so one of my projects, one of the things that I am really passionate about lately is increasing access for people, because many people who are low income are on different state insurances. Medication is really the only treatment, and very limited psychotherapy. Many people have tried those things, and these people just aren't getting access to this as a potential treatment. So I have a nonprofit that I created where I bring people into my online program at reduced or no fee cost. And so I feel like that is a really exciting piece, is that instead of waiting for this to become standard of care, which I know it will, I feel like, well, I saw Jan Ellison did a tweet that she thinks it's coming in 3 years. And I said 5 years and someone else said 10 years. But until this becomes standard of care, the people who need it the most, or some of the people who need it the most, absolutely cannot afford someone like me, or some programs, some different programs. They can't afford access to it. And so the nonprofit provides that. We just go around the system and provide it as support and education.
Yeah, one of the things, as you probably are aware, I mean, I remember when I did my psychiatry rotations in medical school and worked in the ER, we would have a lot of people that would just show up repeatedly in the ER. It's like every weekend they'd come in and, oh, he's back again. He's here for a suicide watch or whatever. And they would admit him over for 24 hours and put him in the paper scrubs and, feed him, and then they'd kick him back out again. And I think, and of course, that's very expensive care, because, episodic, acute, emergent care drives up healthcare costs. And there are people that, some of the guys that are homeless, schizophrenic people that are out on the street. I mean, they cost society millions of dollars a year. And it's not, I'm disparaging them. I'm just saying that
Yeah.
if instead of just, just kind of kicking them out, bringing them back in every week, instead we would say, okay, we're going to admit you and we're going to feed you appropriately. Like, there have now been a couple inpatient trials that have gone forth. I mean, I don't know what's going on with the state of that one in Maryland, where the Maryland Secretary of Health shut it down for some bizarre reason. I'm not even sure why.
Yeah.
But
She's not there anymore.
yeah, I
She's
saw she
not there
left.
anymore.
Yeah, so
And
hopefully it'll go
then
forward. Yeah.
Yeah, and then Deanna Kelly, I can't remember what it's called, but I think so it was Deanna Kelly's study, her and some other researchers. And yes, that was awful. Some of those people were already on a ketogenic diet and they took it away from them in that inpatient hospital. And that health director is not there anymore, thank goodness, in my opinion. And Deanna Kelly is actually in a position to kind of help, I feel like, implement more studies like that in Maryland. So that's exciting.
Yeah, and I think, I was just going back to the cost of this, because if you were to say,
Mm-hmm.
okay, what would it cost for me to take someone and house them for, 8 weeks, 12 weeks, feed them appropriately, maybe nourish their brain for the first time and stabilize them, versus them coming in and out of the ER every week or two. I mean, it's
Yeah.
probably cheaper just to house them and feed them. In my view, I may be wrong
Yeah.
on that, have to do the numbers, but I think it would be. And I think that should be something we start thinking about, because I mean, these people that through no fault of their own, I mean, maybe some of it has to do with their fault, but I mean, a lot of times they're victims of circumstance, and we just kind of we're not helping them. We are just
No,
not clearly helping them. And
we're
and and
not.
we and I think we could. I think the potential for them, with these people we could help, is huge. And the homeless situation is growing. The mental health situation, as has, I don't even know what the rates are. I mean, they've gone up so much, to the point where I think something like 1 in every 4 or 5 people now has a diagnosed mental health disorder, which might make
Right.
some people happy that are in that business, have an unlimited customer stream. But that's not what we should be thinking about. We should be thinking about, how do we actually serve these people best, and so they no longer need our services.
Yeah. Yeah. I have people in psychiatric hospitals reaching out, like inpatient, wanting to do a ketogenic diet and having their loved ones reach out to me ahead of time so that when they get out of the hospital, they can start to implement it. People want this.
Yeah, no, I don't disagree at all.
Yeah.
Um, let's see. What else is there anything else you want to share that we haven't touched on?
Yeah. Well, let me see. Let's see. I'm also doing a recovery study. So I'm a qualitative researcher and I'm doing a recovery study on ketogenic diets. And I'm looking for participants who self-identify as recovered or in the process of recovering due to a ketogenic diet. And I interview them and any family members that have witnessed it. So that's kind of an exciting one. You have to be in the US and you have to have some baseline mood assessments and follow-up assessments to kind of show improvement. But if anyone wants to reach out to me for that, that would be great. And then, of course, supporting the nonprofit would be fantastic if any of your listeners feel called to do that. We've had a huge boon of interest. So I did an interview with Brett Share on Metabolic Mind, and we
Mm-hmm.
got many inquiries, and also Lauren Kennedy West on the Living Well After Schizophrenia YouTube channel did a thing with me, and we got a bunch of inquiries. So I'm getting lots of inquiries, and so supporting the nonprofit would be so wonderful. We have a little bit of a wait list, but we're working really hard. Me and the admin are working hard to get them in. And that is just pretty much it. I've just been a big fan of you for many years. So before I started my ketogenic diet, probably 8 years ago, you were one of the people that I was watching for sure. So it's just really fun to be on here and get to talk to you.
Well, and you're doing great work, and I'm glad you're doing that. And I was going to ask, if you had a person, because almost without exception, every
Mm-hmm.
single provider, whether they're in mental health, psychology, physicians, whatever, nurses, that has been an advocate for this stuff has done it personally, because,
Mm-hmm.
unless it doesn't affect you personally and you don't have skin in the game, you're like, yeah, just keep on the grind, and you don't even think about it. But once you
Yeah.
actually see it for yourself and experience for yourself, you just become an advocate, because you're like, this is how I think I should feel. And you want to share it with other people. And so that was my story. That's what I did. I mean, I was 10 years ago,
Mm-hmm.
12 years ago, I think 12, 13 years ago, when I first started a ketogenic diet before transitioning over to a more carnivore based one. But one other thing, schizophrenia, we think about it as, this is this kind of crazy person I don't want to be in a room with. It's off, this bizarre behavior. But people can go from that, as you mentioned, to a fully normal life, without drugs,
Yes.
with diet. I mean, is that fair to say that you've seen that?
Yes. And it's in the published case study literature also. So Chris Palmer has several
Mhm.
examples of that with Westman, and yeah.
Yeah, and I talked to Chris several years ago, a few times about this stuff before he
Mm-hmm.
got a little more well known. Um, yeah, that's awesome. I mean, it's amazing, and I think if anybody's listening to this and they have either a mental disorder themselves or someone they love has one, it doesn't have to be that way, and it can be fixed for a lot of people, or at least improved significantly. And I think that's the
Yes.
message that more people should hear about that. So,
Yeah.
so you've published a number of papers on that, and you said you've got some in progress right now. What other things would you like to see funded, over time? Like what kind of, because I think we need the interventional trials. I mean, I think that was one of what the Maryland was an attempt to do, or is being done. But, we can, the way the science tends to work, you make the observations and you maybe write up some case series and case reports. And then the next step is let's get some interventions going. Is that what we need to?
Yeah, well, we've got, there's all kinds of, so if people go to metabolicmind.org and they press the little research button on the top, you'll see a map where there are RCTs going on all over the world on this. That's really exciting. And so I am because of my work, I know that I'm very optimistic about what those outcomes are going to be. And what I would like to see clinically, I would like to see inpatient psychiatric hospitals and inpatient substance abuse hospitals that use this intervention, because that's what people are looking for. So I have some wonderful families that I have worked with where they are the legal guardian of someone with severe mental illness, and they don't have the support they need to implement it with that person. That person actually truly needs an inpatient hospital in order to initiate the diet and to keep them on the diet and to help them stabilize on the diet. And then, as they're better, bring them home and have that support system in place ready to go. There is a huge population of parents of adult children with serious mental illness. They really do need some kind of inpatient option that is affordable and covered by insurance, just like the substance abuse places are nowadays, right? And I think that that's a big thing that I would love to see happen for these families and for these individuals. And then the other thing is I want to see, and we will, there was just something that came out that I saw flash by my screen that said that I think the government is going to start to fund these types of studies more directly, metabolic interventions for mental illness. And so that's really exciting. And that's the next step that needs to happen. And it's just all coming together because people want to feel well. People want a piece of this. It's good. And like you said, it's good for the system, the health, the money part of our health system, right? So getting people well and letting them live full, beautiful lives, that is just good for everybody and everything.
Yeah, I mean, it's absolutely a travesty where somebody will go to a substance abuse rehab center, and in fact, when I lived in California, the next door neighbors to us was like a halfway home, and they had these women that were substance abused, and they were always just eating junk all the time, and I was like, this doesn't
Yeah.
make sense. And I've had friends that have said shared their time in rehab. Some of these guys have had drug and alcohol issues, and they said they just fed them junk food the whole time, and it is such a shame. Jay Bhattacharya now is the director of the NIH, and I know he is someone who is, I think, favorable to doing more nutrition studies. And I think that's where some of that money's coming. I just saw somebody texted me yesterday, one of these cattlemen's groups say, hey, we've been awarded a bunch of money to do studies around, ketogenic and carnivore interventions. And so
Cool.
I do think we're going to start seeing more of that taking place. And hopefully, like I said, this will be more accepted. More people will do this because I mean, the solution is not just to drug everybody. And, if we just create more and more, we just got to stop creating so many sick people. And I think that
Yeah.
has to be the solution. And I think it's fixable. Anyway, well, I unfortunately have to get heading out here.
Yeah,
Nicole, it's
no,
been
me
an
too.
absolute pleasure to talk to you finally.
Yeah.
Thank you for sharing what you do. Where do people go to find you?
Oh, mentalhealthketo.com I have a contact form on there if you want to contact me. The nonprofit information is also on that website and under nonprofit, very easy to find on the top. And then the recovery study is also there. So all things Nicole are at that website.
All right. Thanks for doing this. I appreciate it.
Yeah, thank you so much for having me.